As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe.
Canada's window to flatten the curve is closing.
Stay at home, wash your hands well, and practice social distancing.
It's kind of like, okay, we just keep on muscling through and hopefully things start to, settle down or the cases start to go down. There's a handful of us that's worked since March last year, so we haven't had any breaks since then, other than me being in isolation for 2 weeks, but that's not a break. Yeah, you get a lot of spring cleaning done anyway.
COVID-19 has been a bit of a struggle for us all, I think. People have had to learn and adapt very quickly.
I found at first, last year when it first started, it was hard for me not being with my family. I didn't see my family for maybe 6 months and started affecting my mental health. It would just get lonely. And just having that feeling of unknown for the first 3 months, it was just what's going to happen to everybody.
The hardest part for me is that I'm not be able to go anywhere without getting it. I want it to go away.
You're kind of told, stay in your bubble, stay at your house.
Indigenous people, we like to be close together and like to, talk and laugh and hug. And
we as Anishinaabe people like to socialize and gather as a group. We've always done that for hundreds of years. And with this pandemic now, it's tough on our people.
There's a lot of fear, a lot of inconsistency, and where there's a rise in cases in the area, your community goes into lockdown.
Right now we're on lockdown. For us elders, it's okay for us because we stay home most of the time anyway.
My biggest concern is my family getting COVID-19. I'm kind of scared they'll get my cookum sick because she's really been in and out of the hospital in the past few months already.
We used to have, sweats and stuff like that. We can't do it anymore. So a lot of people, it's kind of draining on them too because they can't go and do shaking tents or anything like that. So
powwows. I really like going to powwows, but I got sad this summer because I couldn't go to any because of COVID.
It's not always people that are on reserve too. It's people that are off reserve that are disconnected from their families. That's how I feel. It's I can't really go home to visit or, spend time with my family.
Oh, just worried about everybody. My family, generally everybody.
We get home, the March break happened, and today we're still on the March break. Our school hasn't opened, nothing. Where we have been playing it safe, and I'm proud of my chief and council for doing that.
From what I understand, this is all over the world. This is not just here. We have to have a lockdown. Some people think that we're doing this on purpose to them as punishment, but it's not. And I just hope that they understand the big picture.
I lost my mom in December from COVID, so not being able to go to a funeral was kind of one of those hard things. She was in Calgary in a home. She would have been 73 this year.
It's been very exhausting. It's been very tragic. A lot of fear, a lot of anxiety.
What I have noticed is that people have been very supportive of each other. As soon as people get over that fear, they really work to support each other and work to get through things together. So that's one thing I've noticed.
One of our band members was confirmed he had that COVID-19 viruses. So I was asked to do a healing for him, and I did. But today I see him, he's walking around and doing his chores, so he must pull through it. That's what I use at my house with my traditions. I smudge my house every week.
Being part of the leadership of our community, it is our responsibility to make sure our people are well taken care of. From the start, we got a lot of help with the food part, because what was happening in our town of Kenora, it was scary, because we had shoppers out there all the time and there'll be nothing left on the shelves for our elders. So instead of us taking the food when we get it, we always put it aside and we always made sure our elders were looked after first. Eventually we started getting the help from KCA and other places too as well. So it really helped us a lot, big time. And not just only us, but other First Nation communities around Kenora had the same help.
And I know that a lot of communities are grateful for the support services that they receive.
I really like the hampers though. I like the vegetables in the fruits that were provided.
Well, we're provided with masks. We get food delivered and what do you call those? The face shields.
Save the Children has helped out with donations of face shields and PPE. We've had local businesses help out.
And when we were allowed out, I went out. I went early in the morning and came back before curfew.
KCA has been, it's like the mother. She was a mother to us.
Provide donated food to us, cleaning supplies, and everything they could do to help.
We do our best to provide good stuff for our children. And what KCA and BIMOSE and Grand Council and everyone else that has stepped in, WinHack, they've been like that to us.
We have provided some isolation centers, support services, mental health services.
Vaccine clinics, which a lot of our people here are actually gotten their first dose, so.
I'm at the school, and this is for the 3rd vaccine day in Grassy.
I took it because I want to get back to normal. I want a normal life. I want to be able to go out and around.
I think we're starting to potentially see the end of the pandemic.
Don't think about the negative, just think positive and just think strong, and yeah, you got this.
It really made me realize how much time I was spending working and not with my family. So really appreciating times I get to be with my friends or family.
I wouldn't have my partner here. She would have to move for school, but now we're in this crisis. She's home with us now, so we like that.
Love my people, and this is why I took the vaccine.
Canadians are actually doing really well.
It's still going to take a lot of work on everyone's part, so.
Just wear your mask and keep on keeping on, that's it. Get your shots.